Welcome to Time for Health. I'm your host, Rachel Fall, and we're super glad you've joined us. Every time we get together, we talk about a different health kind of topic, and whether it's useful for you or people that you know and love, we always ask you to share the information. Today, we're talking about mental health, a very important topic. And our expert today is Julie Groover from Bayshore Counseling.
Yes.
Thank you for being here. So mental health is a ginormous topic. We do not have enough time to cover everything here, but
absolutely not.
As a counselor, what are some of the more common mental health concerns that you guys see?
So honestly, depression and anxiety are the major things. There are some outliers, but seasonal affective disorder is something this time of year when the sun is not with us a lot.
Right.
We see some people that are experiencing kind of depression symptoms, and I think depression and anxiety, honestly, to answer the question, are
the top two. And I feel like, and we were talking before we started about statistics, and it's just much more common. Whatever the statistics are, every time I see it, I'm like, wow, that is a lot more common than I feel like a lot of people.
Yeah.
Even.
And I could be wrong on the statistics, so don't quote me, but I think that 1 out of 5 people will suffer from depression at some point in their lives. And that's a lot of people.
That's a lot of people.
And whether it's treated or not treated, it doesn't really matter.
Yeah.
They're still suffering.
And correct me if I'm wrong, but depression and anxiety are the two most common things. And sometimes they happen together. Sometimes depression comes with other things, or anxiety comes with other things. But those are kind of the two major areas that you guys see.
A lot of times they do ride together. They enjoy each other's company, I think.
The chicken and the egg, which one came first?
Yeah. And so sometimes the depression will feed the anxiety, or the anxiety will feed the depression, making the other one kind of more significant to the person too. So, yeah.
So it's up to the part, like what's affecting you the most.
Right.
That's kind of where you start with.
Right.
Okay. So do you know, or do you think that, do they happen because of situational things like no sunshine, a pandemic, a loss of a loved one, or something like that?
Absolutely.
Or is there kind of a genetic component as well?
Yes, absolutely.
Okay.
So all of the above.
All of the above.
Yes.
Okay.
And it could be just a chemical imbalance that is not, things are not firing right in your brain, and you just suffer from depression. And I think a lot of people think it has to look a certain way, right?
Yeah.
And it doesn't have to look a certain way. If you are feeling down more days than you're not, if you are not enjoying things that you used to enjoy, if you have feelings of worthlessness, that kind of thing, you're probably experiencing a level of depression.
Right.
It's not necessarily severe, could be mild, it could be an adjustment, a life adjustment to anything like marriage, divorce, death, anything like that. Moving.
Even good things.
Yeah.
Right?
Yeah.
Can kind of trigger those things.
Yeah.
So it's not necessarily the bad adjustments in life. It can be the good things too, kind of trigger those things.
Absolutely.
And so there's could be some genetic predisposition to it or chemical disposition to it.
Yes.
But then situational things can maybe make
Bring it out. Yeah.
Make it worse.
Yeah.
Or the opposite, could you kind of work with some things in your environment to also make it better?
Absolutely.
A little bit.
Absolutely. So my most favorite thing to tell clients that are suffering from depression, if they have animals, studies have shown that petting a dog for 15 minutes not only releases dopamine in the person's brain, but also in the dog's brain, so it makes both of you happy. And if you look into a dog's eyes, they somehow have tapped into that oxytocin that we get when we have feelings of love for another person or animal. And so both people feel good, or the people and the dog feel good then too.
As a dog owner, I think, yeah, it's very true. So there are things that you can do to manage it. Can you talk about some other things?
Yes.
I am betting that sleep, physical activity, and nutrition are in there too, aren't
Absolutely.
they? Every topic
Yes.
we've ever talked
Yes.
about, those are always in there.
And I think that people I think sleep is a big one that we are like, oh, we'll be fine. And you are fine until you're not, right? So, yeah. And a lot of things like
Physical activity,
yes. Taking a walk even. Like, it doesn't have to be a workout. It doesn't have to be a high calorie.
Pump and iron and
HIIT
running a
workout
marathon.
or anything like that. Yeah. Take a walk. Go out, get fresh air. Being outside has been shown to improve our moods. Spending time with other people, talking to other people is helpful. And I think if it gets bad enough, seek out somebody to talk to.
Yeah,
honestly.
I was thinking about that there are things probably that you can do, pet your dog, go for a walk, nothing overly, eat a little bit better maybe than you have been. You don't have to overhaul your whole life. Yeah. But sometimes those things can help, but they might not get you all the way back to where you want to be. Right. So when do you know?
So honestly, I say seek counseling in the beginning.
Sooner rather than later.
Sooner rather than later, honestly, because it's very, things can kind of go down really quickly.
Yeah.
A pandemic hits out of nowhere.
Right.
And people are kind of stuck.
You're kind of managing and then all of a sudden.
Yeah, and now we're isolating. That's another big one. Don't isolate. But if you do find yourself doing those things, seek treatment. Like, come and talk to somebody. I think people have a view of counseling that is not, it's not right, really.
Well, and that was going to be one of my questions later.
Okay.
So we'll talk about that, because what can a person expect?
So people get very nervous when they come in my office. They'll come in, they'll sit down, and I can see that they're visibly nervous. And I'll say, what's going on? Are you feeling okay? And they'll tell me, I just don't know what to expect. And I tell them, I promise it's not going to be as bad as you think it is. Like, I'm just going to ask some questions. We're going to have a little conversation, and we'll go from there. And at the end of the first session, people are always like, this is not what I thought it was going to be. I'm like, I know. It's really not that bad. It's really just having someone there to kind of get things out, talk to them about, and we can offer you coping skills. Actually, probably not much more than talking to the dog and writing things down. I mean, there are some other things that you can do for depression and anxiety specifically, but like just having that unbiased opinion, and they're not going to judge me if I say I hate my mom or I can't stand my dad at this point in time, whatever the case is. And it just is a place. I work with some small kids, and I tell them that I'm a professional secret keeper. Unless there are really bad things going on, and of course we talk about that. That's just, you get to come in here and talk about all the things you want to talk about.
Judgment-free zone.
Yeah.
There's probably not much you haven't heard over the many years, so
that is
it'll
true.
be pretty hard to surprise you a little bit.
Yeah.
So I feel like the anxiety of just picking up the phone and calling, there's a few mental health agencies in the area, and one, more as you get out and about. But just calling to set up that appointment can kind of be
overwhelming.
A little bit overwhelming. Yeah. So you're encouraging people, just call.
Yeah, just call. Just do it.
And you work with people like insurance and payment and all that kind of stuff?
Yes, and people without insurance. So we have board funding, so we're on a sliding fee scale. If you can't afford to pay, if you're having trouble with your co-pays, we can typically work things out with you.
You don't want that to be another
stressor. Yeah, right. Or a barrier.
Right.
Because we don't want people to say, oh, I've got a $5,000 deductible. I'm not going to do that. That's not helpful.
Right.
People need to be able to get help for what they...
And sooner rather than later, you said.
Yes.
Because I feel like, maybe people might wait, kind of like when you go to the doctor for an ache or pain. You go, some people wait until they can't hardly move. Right. And that's maybe, we could have done a lot more for you.
Right.
We'll, do what we can. So sooner rather than later.
Absolutely.
Okay. I have a question about, I feel like they are in the same realm. Okay. So mental health and addiction issues.
Yes.
Whether, I suppose, addiction to, shopping, gambling,
all the things.
Drugs, alcohol, everything. Are they related? Are they the same? Are they related?
So they're definitely related. So I will say I've seen mental health clients that have no problems with addictions. I don't believe that I've ever seen an addiction client who did not have an underlying mental health problem.
Okay.
So typically the I don't know, maybe the child is having some kind of anxiety, and I'm saying child, but maybe they have some kind of anxiety and they get into their teenage years and they just don't know how to handle it, so they turn to drugs or alcohol, and
Gotcha.
it helps to relax them, or it helps
Right.
to make them feel a little bit better, so they continue down that road. So
Gotcha.
once somebody is into addiction, then the brain just is like, okay, let's go.
Let's go.
Yeah.
We need something different now.
Yeah.
We need more.
Yeah.
So we talked about maybe seeking a professional or something like that sooner rather than later, because you can help teach some of the positive coping things about journaling, going for a walk,
Absolutely.
that kind of stuff,
Yes.
versus some of the stuff that people might use as a coping mechanism that actually just make things worse.
Yeah, so we
Addiction.
have healthy and unhealthy coping skills, right? So healthy coping skills would be taking walks, spending time with family, talking to other people, just not isolating. Unhealthy coping skills would be using drugs or alcohol, self-harming behaviors, gambling, like all kinds of different things. Sex is another
Unhealthy
addiction.
relationships of any kind,
Yeah. So, yeah, all of those things can affect.
They're related.
Yeah.
Okay.
Yeah.
So we kind of talked about things that people can implement to manage things, some of these healthy coping mechanisms. And then maybe sooner rather than later, reaching out for help. And again, we can kind of put a list up there for people to call. There's lots of resources out there. It's so nice. We've been in meetings in Ottawa County and multiple mental health agencies are there, and they're like, well, unfortunately, there's plenty of business, you know what I mean? There's plenty of people who need counseling. Now, is counseling something that is long-term? Can it be short-term? Do people graduate from counseling?
Sure,
Okay.
absolutely. So a lot of times with the substance use disorders, sometimes treatment is ongoing, right? It can be a year long, 2 years long, depends on what their needs are. With the mental health side of things, it's a little bit different. So if people are on medication and they are getting any kind of antidepressant or anything like that from the psychiatrist, then they need ongoing mental health counseling. If you come in and you are going through a life adjustment and you are having some anxiety or depression, it could be 3 to 6 months, and you're done.
Gotcha.
It's not something
Help
that
you kind of work through it.
Yeah.
Sometimes you just need that outside person, because
Right.
I feel like, probably speaking just for myself.
For a friend.
Right, for a friend, that's right. I just sometimes just rattle things around in my head over and over and over again, kind of ruminating. And sometimes you need a friend or a professional or somebody to just say, hey, whoop, time out.
Yeah.
Let's think about it a different way.
People will oftentimes say, just hearing that come out of my mouth, I heard it differently, and I'm like, yeah, that's part of the verbalizing things and talking to other people, being helpful, just getting that out there, I guess.
Yeah, it's very, very important work. We have 1 minute left. Any last minute things you're like, oh, I wish people knew?
I wish people knew that counseling is not bad. It's not a punishment for anything. It's a way to help you manage your life a little bit better. It's not a bad thing.
Not a weakness or anything like that.
Reach out for help. I'm telling you, there are more people struggling with something similar to what you're struggling with than you think.
Awesome.
So,
Thanks, Julie.
You're welcome.
All right. So, a little bit of information about all kinds of mental health things, depression and anxiety primarily, and all the things we can do to help and when to reach out for a professional. So again, hopefully maybe it's useful for you, or share it with somebody maybe that it might be useful for. And until we meet again, I encourage you to make time for health.